Imagine waking up in a recovery room after an emergency surgery. Now, imagine that ward operating with less than half the staff required to keep you safe. By 2030, Malaysia's health ministry projects a 60% shortage of nurses. It's a deficit driven by a highly volatile current workforce. 72.9% of nurses in Malaysian private hospitals admit they are ready to leave for a better offer. A deficit of that scale slashes the bandwidth for patient surveillance, medication administration, and the rapid response required when post-operative complications arise. The immediate gap in the private sector requires over 9,000 additional nurses by 2025 just to maintain basic operational viability. Even as the global market screams for healthcare workers, the data shows that qualified professionals are available in record numbers. This map of the Indonesian archipelago shows a projected surplus of nearly 700,000 nurses by 2025. This human capital is currently trapped on the island of Java by geographic maldistribution and state-level budget constraints, leaving the surrounding islands severely understaffed. In the Philippines, where public hospitals are debating hiring unlicensed graduates to fill critical gaps, there are 124,000 fully licensed registered nurses who are currently choosing to stay off the sidelines. These nurses are effectively on strike against a broken system, forcing us to examine the psychological ledger that dictates where they choose to work. The Malaysian nursing workforce is overwhelmingly female, under the age of 40, and in their prime family-building years. These individuals balance the high emotional toll of patient care against the rising cost of living in Kuala Lumpur and the complex logistics of raising young children. Despite these pressures, clinical effectiveness remains high. Nearly 70% of nurses report confidence in their clinical duties and feel supported by peers. The bedside environment is holding steady. The instability originates in the payroll office and the administrative suites. Herzberg's two-factor theory provides a lens to see why. It categorizes workplace elements into hygiene factors and motivators. Hygiene factors are the baseline requirements: salary, physical safety, and administrative efficiency. While their presence doesn't create loyalty, their absence creates active dissatisfaction. It's a foundational requirement that Malaysian hospitals are currently failing to meet. Only 17.6% of surveyed Malaysian nurses believe their pay is consistent with their service. When less than a fifth of a workforce feels fairly compensated, the foundation of the institution begins to crack. This financial disillusionment transforms passive unhappiness into active planning for an overseas exit. The right side of the ledger contains the motivators: clinical autonomy and visible career progression. These are the only factors that generate genuine institutional loyalty. In Malaysia, only 32% of nurses see a path for advancement. This creates career compromise, where a nurse calculates that staying with their hospital means sacrificing their professional potential. Singapore has built an ecosystem designed to solve both sides of this ledger. They secure hygiene factors through massive financial anchors, like the $100,000 Angel Scheme and dedicated housing for foreign healthcare workers. They then address the motivators by dismantling industrial-era scheduling. At Tan Tock Seng Hospital, nurses choose from 9 flexible shift options, supported by technology that compresses shift handover times from 1 hour down to 15 minutes. This efficiency allows nurses to practice at the apex of their license. Advanced practice nurses in Singapore function as autonomous clinical leaders, managing chronic care and making frontline decisions that were historically reserved for doctors. By flattening the medical hierarchy, Singapore transforms the role from physical labor to a respected intellectual asset. In a globalized market, human capital follows capital investment. When one country provides a living wage and a career trajectory, talent moves toward that hub. Malaysia bears the developmental cost of educating these nurses, providing their early clinical training, only to export that expertise to Singapore during their most specialized prime working years. Regional frameworks like the ASEAN Mutual Recognition Arrangement remove the final friction from this flow, acting as a pipeline that accelerates the brain drain toward higher-income nations. Developing nations are effectively subsidizing the healthcare systems of their wealthier neighbors through a continuous extraction of human skill. If a hospital system treats a highly trained workforce as an expendable commodity, those workers will act like commodities and sell their labor to the highest bidder on the global market. The arrival of Generation Z, a cohort with high expectations for mental health support and work-life boundaries, leaves no room for the rigid management models of the past. The emergence of artificial intelligence offers a specific tool to address the administrative friction that drives this burnout. By automating digital charting, predictive scheduling, and complex billing, technology can strip away the bureaucratic overhead that currently consumes hours of the nursing shift. If technology can absorb the clerical burden, it leaves the nurse with the one thing a machine cannot replicate: the direct human care that the profession was built for.